Good morning. Merry Christmas. BC Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. Honored to provide to you a briefing on respiratory illness season today. We're both honored to be on the territory of the Lekwungen-speaking people, the Songhees and nations. And with that, it's my honor to introduce Dr. Bonnie Henry.
Thank you very much and good morning. Today we're going to share some information about the respiratory illness season across British Columbia and the ongoing immunization campaign. And it's particularly important as we're heading into that holiday season where we all want to spend time with friends and family and loved ones, and particularly with the indoor gatherings that we tend to of year. So the good news is that COVID-19 activity continues to decrease and stay relatively low since the peak that we had in early October this year, while influenza A, on the other hand, and it's mostly the H strain, and RSV activity are starting to increase now. And this is important. This is something why we need to pay attention to what's going on right now. We're also seeing that more people are seeking healthcare providers for respiratory symptoms. So that's going up both in adults and in children. The BC CDC weekly data updates, which you can see on their website every Thursday, make it clear that we are well into respiratory season and is looking much more like the typical we used to have prior to the pandemic, with peaks particularly of influenza and RSV But influenza, we tend to see peaks after the holiday period in late December, early January. So now is the time for preventive measures to try and stop that peak. We're also seeing a variety of other viruses causing illnesses over the holiday season. And again, that's similar to what we used to see before COVID came on the scene. So as I mentioned, the 19 test positivity cases, hospitalizations, and deaths have decreased since early October when our vaccination program began and are remaining low but steady in BC. And I know many people I talk to have had friends and family the last few months. The trends and indicators of COVID-19 activity vary across the provinces and territories in the country. And what we see is that it is increased slightly in some other areas of the country in recent weeks. And this that we are in a transition year still. It's not clear yet what pattern the SARS-CoV-2 virus is going to take. We're still trying to understand the seasonality of it, or if there is going to be a pattern, and what pattern that will be in the long term. In the past few years, since it came on the scene, we have seen an increase again in the spring. So we'll be continuing to monitor that. And again, it reminds us that we can take prevention measures now that will help us into the spring as well. And getting that updated COVID vaccine. So while influenza A levels continue to increase at various monitored sites, so both the emergency department visits to primary care physicians and our wastewater surveillance, sensitivity is starting to increase. We're well within what we call the normal respiratory illness season for influenza right now. As I mentioned, the majority of what we're seeing right now when we do the whole genome sequencing is the H1N1. And in some ways, that's a really good thing. It tends to cause less severe illness than the H3N2 strain that we also see circulating, which is especially problematic, particularly for older people. But what we do know is that H1N1 can cause more severe illness in younger people. So we need to be aware of that. And we need to make sure that we protect young people as well. And anybody over 6 months of age is eligible for the vaccine. And while we'll have vaccine effectiveness data later in the season, we have taken a look at the BC CDC lab. They've taken a look at the genetic information we have from what those influenza viruses that are circulating so far in BC. You can see that they match very closely to these strains of influenza virus used to make this year's annual vaccine. So what that means is that the influenza vaccines that we have available now for everybody should be very effective in helping protect you and your loved ones from getting seriously sick if you get influenza in the next little while. So that reminds us it's not too late to get that extra protection by getting vaccinated, particularly before spending time with family, children, older family members, people in long-term care homes who are more likely to have more severe illness or complications. In terms of the other major virus that we see around this time of year, RSV or virus, data from BC Children's Hospital and from BC CDC show that RSV is increasingly causing illness, especially in children. And we saw that in the last 2 years in particular. The wastewater surveillance that shows that it's particularly increased in the Fraser Health Region and the Vancouver Coastal Health Region. The test positivity is high amongst children, and we know that RSV has a particular impact each year amongst very young children, particularly the first time exposed to it. And we saw in the last 2 years when we didn't have RSV for a year or two that it did have an increased impact and relatively earlier in the season last year. So we're seeing a more normal pattern this year, again, that it can cause very severe illness in young children. And so both RSV A and B, so we're learning a lot more about RSV from some of the work that we're doing, particularly around wastewater genome sequencing program, and we're understanding that there's more than one type of RSV and looking at those patterns. We also know there are many other cold viruses that are making people sick right now, and they have names and enteroviruses and parainfluenza. So we know, and I know people have been telling me, and I've seen it in my friends and family too, that there's lots of people out there with the sniffles and coughs and colds. And this is reflected in overall adult visit for respiratory symptoms, and visits to primary care providers have increased in the last few weeks. And we see the same thing in pediatric emergency department visits. So we know we are in that part of the season right now where things are increasing, and we know we're also coming to that point of time where we want to get together with others. So while specifically for COVID-19, the number of hospitalizations per week has decreased from the peak of about 330 that we had in that first week of October, and our most recent data shows that there's 182 people in hospital with a positive COVID test, and 17 of those are in critical care. But there remains high rates of emergency department visits and some hospital visits for other illnesses. I know there's been a concern raised, we've heard it reported in the media and other places about children, particularly in China, being ill, and the concern about mycoplasma pneumonia, which is a type of pneumonia that we see sporadically. And we have been monitoring that both at the Public Health Laboratory here at BC CDC and in collaboration with BC Children's Hospital. And we have seen some sporadic cases of mycoplasma, in adults or children above what we would normally see in a pre-pandemic year in BC. It is important that in the midst of respiratory seasons, a variety of different viruses or bacteria can cause. And if symptoms are severe, so particularly if you have difficulty breathing or you're not improving after a few days to a week, it is important to continue to seek medical attention. But going back to it, there are things that will help. The single most important thing we can do to prevent getting sick in this time of year is to strengthen our immune system by getting the updated COVID vaccines and our influenza vaccine. And most people this year are able to get those at the same time. We know that this process began in October with our priority population, so older people, residents of long-term care homes, Indigenous people, pregnant people, healthcare workers. To date, by the end of yesterday, we had 1.4 million doses of influenza vaccines and more than 1.2 million doses of the COVID vaccines this season. So we know that these are well matched, as I mentioned, to what we're seeing circulate. And for those who have not yet booked your, get that gift now. If you get those vaccines this week, they're widely available across the province in over 800 pharmacies. And you can get those vaccines now. You'll be protected as you go into the main part of the holiday season. You do this for your friends, your family, your teammates, and for our community. We know from what we've seen in the past years that the holidays can be a time where illness spreads when we get together with family, friends, loved ones, and primarily. And we need to keep our guard up and take important steps like getting those vaccines now. As well, we want to make sure that when we do get together, we get together safely. We know there are important messages. Again, the importance of those healthy habits, cleaning your hands regularly, cover your cough or sneeze, wearing a mask if you're going to be in indoor spaces with others and you have mild symptoms or are still recovering, or if you're somebody who is at high risk, you're wearing a well-fitted mask if you need to be in indoor crowded spaces. But really importantly, this includes staying home if you have symptoms of a cough, a runny nose, fatigue, and especially a fever. A fever is generally an indication that may be transmissible to others. And so if you're the one hosting or part of gatherings this holiday season, make it okay for people who aren't feeling well not to come in person. We have all learned over these last few ways. There's ways to make it easy and meaningful for people to participate remotely and still be part of the gathering, whether it's using virtual visits or postponing a visit to somebody in long-term care until you are well. These are ways to love and protect those who are at most risk of severe illness or complications if they get sick. As I said, there's plenty of supply of vaccine province-wide, and you can get an appointment in your area this week. Like the more than 1 million people who've already done that, we can all do our part, and it is not too late to make a big difference in trying to prevent the spread of influenza over the next few weeks. Especially urge those who are over age of 80 or people who are clinically extremely vulnerable to book your shot today. We know that over half of people over age 65 have gotten both their vaccines, but there's still a risk out there for many. So the other thing I want to note is that last week Health Canada approved the updated Novavax vaccine. So this is a more traditional protein subunit vaccine, also designed to protect against the circulating strain. So it's based on SARS-CoV-2 strain as well. And it will be available starting this week in BC for people who prefer not to have the mRNA vaccines or have had issues with them in the past. And it's available for people 12 years of age and up. So if still need to book an appointment or wants to find out about the Novavax vaccine, I encourage you to call 1-833-838-2323 for assistance if you need it, or you can go to the Get Registered online. I do want to make a comment about avian influenza. You may be aware that we continue to see an increase in high pathogenic avian influenza activity in British Columbia, and that's affecting more than 50 flocks around primarily the Lower Mainland, but also the on Vancouver Island have been infected with this strain of bird flu or avian influenza called H5N1. There's always a concern that a person could become infected with human influenza and avian at the same time, and that could provide an opportunity for this virus to mutate, to infect humans more easily, and increase the risk of a pandemic. To reduce that potential, getting the seasonal influenza vaccine is especially important for people who are working in the poultry industry, and we've been having a partnership with the Ministry of Agriculture, with CFIA, with the poultry producers here and public health to make sure that people working in the industry have access to vaccine and to the personal protective equipment they need. And while we know that this virus is spreading globally, through migratory wildfowl, so things like ducks and geese who migrate, and it mostly affects birds like chickens, turkey, geese, and ducks. It can affect other wild animals, and we've seen that happen as well, including cats and bears and mink. This is a good opportunity to remind everyone that if you do come across sick or dead wild animal or birds, you shouldn't touch them or bring them home with you, and make sure that pets as well keep them away from sick or dead animals. You can report them as well. If you come across a dead bird, you can report it by calling 1-866-431-BIRD, which is 2473. So generally, as we enter this holiday season and celebrations and gatherings, so important for us after all we've been through in the last few years, it's time now, it's not too late, to get your updated COVID-19 and influenza vaccines if you haven't done that already. We all need to continue to do this part for ourselves, for our family, our friends, and for those who are more vulnerable in our communities. So the best things we can do are staying up to date with our vaccinations, taking those regular precautions that should be part of our life now, like covering your mouth with your sleeve or elbow when you cough, wearing a mask when it's needed, cleaning your hands regularly, and of course checking in with yourself and your children and making sure if you are sick with something that can pass on to others, that you stay away until you're feeling better. We can all spend time with the ones we love and ensure we aren't passing on an unwanted guest at the same time. So thank you very much. I hope everybody enjoys a happy and safe and healthy holiday season. I'll turn it over to Minister Dix.
Thank you very much, and thank you very much, Dr. Henry. And I really want to acknowledge the exceptional work of everybody in public health, everybody who works in community pharmacy and hospitals, and the communities around British Columbia in long-term care, for all of their work this year and throughout the pandemic. We forget the extraordinary sacrifice sometimes as we try and focus, and sometimes we try and move on to other things that people have made, and it continues to be shown in some exceptional results that we've had in British Columbia. I want to just touch on quickly on three subjects. The first, vaccination, the second, hospitalization, and the third, surgeries in BC as part of this update. Since the start of the pandemic, people of BC, and they've been the key element in all this, have adopted vaccination more than virtually any other jurisdiction in North America. That is certainly true this year. As Dr. Henry has said, as of December 10th, last night at midnight, BC had administered 1,443,752 doses of flu vaccines and 1,289,849 doses of COVID-19 vaccines. And these results compare with what we did last year, when obviously there was more intensity around these questions last year, both for influenza and for COVID-19. And it's in fact one of the reasons, I think, that we've seen some better results, particularly with respect to COVID-19 so far. Last year we had a record-breaking influenza vaccine season, as you'll know, and at this time last year, week 9 of the campaign, we were at 1 million. And last year at this time in the COVID-19 fall campaign, we were at 1.18 million. So we're slightly ahead of where we were on COVID-19, slightly behind where we were on influenza last year. But in terms of national comparison, what has happened here in British Columbia, and I think it really reflects on the commitment of people to one another here, their commitment to get vaccinated, and this vaccination system that is put in place that is in some ways a legacy of the work done in COVID-19, the immunization system in BC, and the work by both public health and community pharmacy. Just as an example, and these are national statistics from last week, from December 3rd, the level of vaccination in British Columbia against, with the new COVID-19 vaccines is twice as high as it is in Ontario. Twice as high, well above any other jurisdiction in the country. And this reflects well, I think, on what we're doing in BC. But of course, this is not the Canada Games. And we want everybody to do well. We want everybody to be first. And of course, every day, people come from other jurisdictions in the country to British Columbia. And this is an argument to get vaccinated in British Columbia, to take this advantage of this period when there are, in some health authorities, 90% availability of appointments to get vaccinated here in British Columbia. It will protect you, your loved ones. If you have a multi-generational family, it's important to get vaccinated. If you have grandparents, it's important to get vaccinated. If your brother has type 1 diabetes, it's important to get vaccinated. It's important to get vaccinated. And that is true in other jurisdictions as well. If you're coming home to British Columbia, get vaccinated. If you're not coming home to British Columbia over Christmas, get vaccinated. This is an important time to take advantage of the availability in every province in Canada and in communities in every part of British Columbia to get vaccinated. And I really encourage people to take that opportunity. We are doing better than everywhere else, but that doesn't help you if you haven't been vaccinated. It's important to take this opportunity to do so, and I strongly encourage everyone to do so. One of the reasons why it's of value, I think, to get vaccinated is the impact it can have and the support it can have for our hospitals as we go through, as we've seen, a record period of demand for healthcare services in BC. For COVID-19, as Dr. Henry has said, hospitalizations, the number of hospitalizations is down, decreased from a peak of 334 from October 1st to 7th to 116 from November 26th to December 2nd. This is encouraging to see. You'll remember, for example, in the week of January 24th to 30th, we had an average hospitalization from COVID-19 of 2022, I should say, during the Omicron variant of concern. We had an average hospitalization rate of 973. This is better. But in addition, we also are dealing with other respiratory illnesses and dealing, as I noted, with significant demand for healthcare. That significant demand for healthcare is reflected in our acute care census. You'll recall, as we prepared for respiratory illness season this year, we increased our base bed capacity in BC. In other words, the base hospital bed capacity of the province from 9,200 to 9,929. And what we're seeing right now is that those beds are, of course, fully allocated. We also have a significant number of surge beds in addition to that as well, another significant number of beds, which allows us to respond to increased demand. As of December 7th, the number of hospitalized inpatients in BC was 10,102. It's the peak this winter so far, or this fall, I should say, is 10,128. And we've put in place access and flow teams for all hospitals 7 days a week. We've prioritized healthcare services. We've increased the number of acute care beds, and the work and the teamwork of BCHS and our hospitals is excellent. But we are seeing significant demand for hospital services, and it justifies the decisions made to increase and to regularize hospital beds in our system. We're also adding things like hospital at home beds. And so I think throughout the system, we are better prepared than we have been at any time to deal with these large number of patients. But the fact of the matter is that we're facing in a continued period in the course of a week of 10,000 patients in our public healthcare system. As a result, we are continuing to prepare, as we have been preparing in September, for what we would expect to see a growth in those numbers in the first part of January, which is our absolute peak season. You'll recall that last year in January, at around January 6th, we reached 10,280 inpatients in hospital in British Columbia, and we are approximately 170 above where we were last year right now. So if that pattern were to be maintained, we would be seeing record numbers of people in hospital, and that's why we've taken such significant actions to prepare for that. Finally, I just want to talk about briefly about the surgical renewal commitment of the province, and just to note that we have been performing the public healthcare system, our doctors, our nurses, our health sciences professionals, all the people who keep operating rooms clean, and all the people who work on the administration of our surgical system. We have been performing at the highest level ever as a health system and as a province. In the week of October 22nd to October 28th, performed 7,781 surgeries, which is an all-time record. In fact, shatters an all-time record. It's not quite Bob Beeman, but it's still a very significant increase in the number of surgeries done, and that means people getting care sooner in our province. The overall records, it was a record October, a record November, a record December in the number of surgeries performed in BC. And this is a real reflection of the work that has been done since May 2020 to put surgical renewal in effect. It's meant more anesthesiologists, more operating room nurses, a health human resources plan around surgery that was significant, and an absolute increase in our capacity in every part of the province to do surgeries. We still face challenges in some communities, as you know, and there's sometimes significant reports when we can't perform or we don't have full capacity of 100 or 200 surgeries. We're talking about every week breaking the overall numbers for surgeries by hundreds here on Vancouver Island, for example, and everywhere else in BC. So this is a real achievement of our public healthcare system, but of course, to do so and to continue to see this level of work also increases demand in our hospitals. It's the kind of demand that we want to have, because we want people to get their surgeries as soon as possible. But it really is an argument for us to do in this respiratory illness season, to adopt healthy habits that we've learned during the COVID-19 pandemic. To stay home when you're sick, that's critically important. To wash your hands regularly, it's critically important. Did I say stay home when you're sick? That's really important, and that means not just going to work, but that means going to family gatherings and other things where you can potentially have vulnerable people near you. And finally, get vaccinated. There are appointments available in every community. There's an opportunity to get vaccinated. It takes very little time, very little effort, and the benefit, not just for you, but for your family and your loved ones and your community, those that you know and you do not know, is profound. I am very proud of British Columbia's response to the COVID-19 pandemic and to these profound public health issues that we faced, unprecedented in our lifetimes, at least in my lifetime. and we've got to continue to do that. British Columbians have led the way, not the health system, not the government. British Columbians have led the way. And this fall and this winter, we need to continue to do that and take the opportunity as we enter into this holiday season, into the Christmas season, to get vaccinated. Thank you very much, and I'll return the podium to Dr. Henry, and we'll be happy to take your questions.
A reminder to reporters on the line to press star 1 to enter the queue. Reporters will be able to ask one question and one follow-up. We'll start in the room. Richard Zisman, Global News. Go ahead, Richard.
Dr. Henry, we look at the numbers in terms of vaccination rates. Minister Dix said this as well. They've gone down in all the health authorities. We look at COVID cases. They are less significant. They have been in the past. What is the province doing to increase those immunization rates rather than just stand up here and say, go get a shot, considering we may have a waning? All those who wanted to get it have gone to get it, and we may be at that point where it's just sort of flatlining.
Well, I think there's a couple of things there. One is our Get Vaccinated system is sending out reminders to people, and that we know is the effective way to trigger that. The other thing that we're seeing and that I'm hearing from people is many people have had COVID over the last few months, usually, if they're vaccinated, a relatively mild illness. So we have suggested that people wait around 3 months or so, because getting a vaccine right after an infection doesn't boost your immunity that much. So now that we're starting to see more people coming in than for the flu vaccine. So that tells me that there are some people who have been waiting, either because it wasn't 5 or 6 months since they had their last COVID vaccine, or because they had an infection in between. But really important now, as we go into this season, we're starting to see influenza again. And influenza A can cause very severe illness. It's a more normal pattern from what we were seeing prior to the pandemic. So we expect that that's going to increase still. So never too late, and particularly get it this week and you'll have the maximum protection as we go into the main part of the holiday season.
Go ahead with a follow-up.
If you go and get your vaccine, people have waited for normalcy around the holiday season for 3+ years now. Even last year, events were canceled. What do you say to someone who is finally waiting to go to that holiday party that they have waited 3+ years to, and they experience the sniffles and maybe a sore throat? Haven't we asked people to do enough, in essence, considering we aren't seeing that severe of outcomes when it comes to flu and COVID in terms of hospitalizations?
Yeah, and you know, this is the thing that we've learned, is what may be a mild illness for me may not be a mild illness for somebody who's more at risk. So particularly our elders and seniors, we know that what can be mild for us, even after vaccination, can cause more severe illness, and we see that with influenza as well. So we've learned all kinds of ways that people can meaningfully come together and participate in these events together. So find ways to do that. Make it okay if the kids aren't feeling well, for you to have a separate at-home party with other family members, and postpone it. Postpone it for a time when everybody's feeling well, if you can. You know, these are moments where we don't want to ruin it by passing on a virus, even if it's just a cold virus, to somebody who may get really sick with it. So if we have family members who are going through chemotherapy, who are immune compromised, we need to all say it's okay for us not to come together if we're not feeling well.
Great. Next question, Rob Buffum, CTV.
Hi, Dr. Henry. Just wondering if I understand the numbers correctly. This is the second year in a row that flu shots, there's been more of those administered than COVID shots. Are we sort of, is this the new normal now? And in terms of people feeling as though COVID is maybe not as big of a concern? And are you more worried about flu than you are COVID at this point?
Well, yes and no. We still don't know yet about the seasonality of COVID. So the shot that you get now, I think, interestingly, that our decrease really corresponded with the peak of vaccination when we started our vaccination program, which tells me that we can have an effect on COVID, but we know that it's still around. And we're seeing in other provinces that particularly in areas with low immunization rates, that they're starting to see increases again. And in the last 2 years, we've also seen peaks in the spring. So there's things that we don't yet know about the SARS-CoV-2 virus and what pattern it's going to fall into. But I am thinking that more and more we're likely to be similar to influenza, where we get an updated vaccine on a periodic basis, whether that means yearly or every couple years. The virus is not changing as fast as it was changing previously. And part of that is because of the level of immunity and there's only certain things that the virus can do. So we're still seeing a lot of HV1 in the BA 2.86, and the switching of the virus is not as fast as it was before. So still don't know about that. I've always been concerned about influenza. And what I see is we usually see people who are at highest risk get their vaccines first, and then for younger people, they may not think about it, but the H1N1 that we're seeing this year can cause severe illness in children. We know that. So children need their influenza vaccines too, as do older people. And yes, at this point in time, COVID seems to be low, steady, hasn't gone away. But in the next few weeks, we're going to see more influenza. So I am concerned about it today. But, as we go into the winter season and into the spring, that may change again. So what you do now will protect you for that as well.
Just one thing on the numbers that you said, Rob. What you're seeing is a closing of those numbers now. So early on in the season, early on in our immunization season, there was a gap that developed. I think it was about 220,000, and then it's been dropping over the last number of weeks. And it's partly because of eligibility. Like, there were very few people, obviously, essentially no one had influenza in the period immediately before the shot, so they were all eligible to get it. Right at that point, there was no one who had got it, say, in the summer, who were a vaccine-taking population, if you will. So that number is closing, and I think it's going to end up pretty close to even between the two. So I don't think what you were suggesting was happening is actually happening. I think you'll see, as we get through the season, say we get to the end of the vaccination season, to January 10th, 15th, it'll be pretty close.
Rob, you have a follow-up?
I do, thanks. Just wondering about, when you look at these numbers, even for people who are over 80 and clinically vulnerable, who've had access to a COVID shot since early October, presumably would have taken action if they wanted to by now. It's less than 50% of BC's population. I know that compares favorably to the rest of the country, but are you concerned that there's still, presumably you are, otherwise you wouldn't be making this announcement today, but tell me about that. And then I wanted to roll in as well, just by way of clarity, if I test positive for COVID tomorrow morning and I've got a sore throat, or anyone else does, what's your advice? Does it remain, if you're able to go about your normal functions, go to work, maybe don't go to a Christmas party with a elderly grandparent, but you can go to work and continue like your advice has been?
Yeah, so in terms of sorry, your first question was about, am I concerned about, we look at age group and people with underlying immune compromising conditions, etc., and the rates go up when you split it like that. But yes, there are still people out there who are at risk of having severe illness from COVID, from influenza, who have not yet been vaccinated, and that's one of the reasons we're talking today, is to say it's not too late, and particularly if you're going to be around others, if you're in large family groups, if you have kids and elders coming together, we all need to do the best we can to protect each other. There's lots of people with very mild sort of sore throat, and you're never quite sure if it's something brewing or if it's just because you had a late night. So in those situations, if you don't have a fever and you're feeling okay, a little bit of a scratchy throat, those are times where you want to stay away from people who are more at risk. If you're working, maybe work remotely if you can, or wear a mask if you have to be around other people. And, that's what I've been doing. I had my first scratchy throat a couple of weeks ago, and it didn't turn out to be anything, but, clean my hands regularly, stayed home for a day, wore a mask when I went into work the next day. So those are the things that we can all do now that make a difference.
Dirk, Canadian Press. Go ahead, Dirk.
Dr. Henry, you said something earlier in your speech or your news conference here about a pneumonia kind of situation in China.
Right.
Can you elaborate a bit more on what might be happening?
Sure. So there was some concern about 2 weeks ago that there was a surge of particularly young people going to hospital in a number of areas of China, particularly around Beijing and that province. The WHO asked for more information from China about what was happening, and their investigation showed that it was a variety of illnesses. And the concern is that this is the first year where they haven't had major restrictions in place in across China because of COVID, and that younger people are being exposed to the usual things that they hadn't seen for a few years. We saw a very similar thing last year where we had an early peak of influenza and RSV, particularly in children, early on in the season. So we're not seeing that as much this year. The other thing that was concerning was reports of a type of pneumonia. We call it walking pneumonia, or an atypical pneumonia caused by a bacteria called Mycoplasma pneumoniae. And we monitor that in British Columbia every year. We have past sporadic cases, and it is something that can be a complication of a viral infection. In some people, when they get a viral infection, the inflammation in their lungs makes them more susceptible to getting a pneumonia afterwards from a bacteria. And this is one of the ones that we've been monitoring for. We have what's called a Sentinel Physician Surveillance Network across the country. So it's 4 provinces across the country that's run out of the BC CDC. And they test for Mycoplasma pneumonia. And we've seen, I think, 2 across the country this year, 1 here in BC. And we normally see sporadic cases. Like, this is prior to the pandemic. We would see them now and then, and we're seeing a very similar pattern now. So we're not seeing a concerning increase in this type of pneumonia in BC, and we'll continue to watch for it. And things seem to be settling down in China. It's very likely that the pattern that they saw was very similar to what we saw last year.
Sure. Coming into work today and on the weekend, I'm just wondering why some people wear a mask outdoors.
You know, I think it's personal preference. Some people feel more comfortable. They just wear it all the time. The risk is much less when you're outdoors. We know that. But for some people, it's convenient. If they're feeling unwell themselves, it's a way of preventing germs from leaving you as well. We know that some people wear it because it protects them from pollens and pollution in the air, things like that. So there are many reasons why people do it. For me, the most important time to wear a mask is when you're in crowded indoor settings, particularly around people you don't know. And if you're somebody more at risk, then wearing a mask is maybe an appropriate thing. The other place where, as you know, we think it's incredibly important for us to wear masks regularly is in healthcare settings, especially this time of year. We know there's people with respiratory illnesses that are going into emergency departments, going into our hospitals, going into clinics, and so that's a time when all of us should be wearing a mask, and that's part of our infection control protocols in the healthcare setting right now.
Next, we'll go to the phone. Lisa Yusta, City News. Go ahead. Lisa, are you there? We'll come back to you. We'll go now to...
you hear me on this line?
Go ahead. Yep.
Okay, sorry. I do anyways. Multitasking. First, about the vaccines. I had a conversation with someone last week who's very educated, who's like, "Oh, I don't think I need the shot." I'm wondering, Dr. Henry, does your head just feel like it's going to pop off sometimes with people having this amazing thing available to them and just not taking it?
You know, there's a variety of reasons so that people may or may not take it. If you've had at least your 3 vaccines, so the primary series, a booster, and a recent infection, then yeah, maybe right now you don't need it. But I still encourage everybody. We know that the protection, these are the things that we're learning as we're going through each year, because we can only follow things as we go. And we know that protection from at least the primary series and 1 booster gives you strong protection of that cell-mediated immunity, that memory immunity that protects against more severe illness, hospitalizations. But the protection against getting infected in the first place goes down after a few months. And that's why when we see a lot of the virus circulating, we want to boost up that protection against infection. And that's what the booster dose does, or that's what this year's updated dose does. It trains your immune system to recognize the slightly different strains that are circulating right now. So if I would encourage everybody who's not had the updated vaccine, so the XBB, that gives that special, separate, updated protection against what we're seeing out there right now. So it is important. It's something that will boost up your immune system, give them a little bit of extra protection, and protection against getting infected in the first place.
Lisa, do you have a follow-up?
On a slightly different, well, on a different subject entirely, the city of Vancouver is considering, council's considering increasing the number of licenses, liquor licenses, extending some of the liquor hours, the hours that liquor is accessible. And I'm wondering what kind of health concerns you have to making alcohol more accessible in Metro Vancouver and making it easier to get licenses and I guess just making it more accessible.
Well, this is something that we've written letters on, we've done some reports on. My office is working on another PHO report on alcohol, and we know that increasing accessibility and lowering of cost also leads to increased problematic alcohol use. I would refer the City of Vancouver to a very excellent report done by Dr. Patty Daly and her team at Vancouver Coastal Health around the public health impacts of increasing accessibility to alcohol. I think it sums it up nicely, and I know she's presented that to Council.
Next, we'll go to Zara Premji from CBC.
Yes, thank you. My question is quite similar to Lisa's, but I'm still going to ask it. There are some people out there who just don't want the vaccine. They're not against it. They just don't want it. They've never gotten it. They don't feel they need it. Dr. Henry or Minister Dix, what is your message to them? What would you say directly to them when they say, I just don't want it and I don't need it?
You know, most young, healthy people, we go through that phase where we think we're invincible. We know from the data that shows if you're unvaccinated across the board, so the vast majority of people in British Columbia have had at least 2 doses of vaccine. The vast majority have had at least 1 booster dose after that. And we know from our seroprevalence studies that many people have had an infection, often an inapparent infection. So if you're vaccinated, you may not even recognize that you've had it. And that's the good news. So across the board, when we compare people who have vaccines, plus or minus infection, with people who have not had any vaccine, they are at much higher risk of having more severe illness, ending up in hospital, or even dying. So that is irrefutable. That's out there. So I do encourage people to do the best they can for themselves, and that means increasing your own protection by getting this vaccine and getting the updated one. If you haven't had one yet, getting this updated one will give you the best protection going forward, and you just need the one. It also protects those around you. You may be fine and you may have a mild infection, you may not get that sick with it, but you can pass it on to somebody else who may be at more risk.
Zara, do you have a follow-up?
Yes, actually it's Richard's question, but I'm hoping to see if we can get the answer in French as far as what is the province doing to increase immunization rates?
Premièrement, force est de reconnaître qu'on mène le pays, n'est-ce pas? Donc, ce qu'on fait, c'est mieux que toutes les autres provinces, tous les territoires du pays. Par exemple, je pense que c'est 60% en plus de la province du Québec. Donc, c'est important ce qu'on a fait. On a une campagne publicitaire au sujet de Healthy Habits qu'on a dans plusieurs langues dans la province. On va continuer à faire cet effort. Je pense que la meilleure façon qu'on attire des gens, c'est notre système de vaccination qui est simple et facile. On donne on envoie des textes à tout le monde et cela a un effet positif, je pense. Et ce système qui a été développé pendant la pandémie, la deuxième année de la pandémie, a eu un grand effet. Donc, il faut continuer nos efforts. Je pense que ces efforts, en comparaison, sont remarquables, Mais il faut faire encore plus et il y a une vraie opportunité dans les prochaines 2 semaines je pense, d'avoir plus de vaccination et de protéger tout le monde de mieux pendant cette période de célébration qui est la période de Noël.
Great. Next, we'll go to Mindy Wen from Fairchild. Mindy, go ahead.
Hi, Minister Dix and Dr. Henry. I noticed that in BC, the RSV vaccine is not free for people, and it is quite expensive for the public to get the vaccine. So I'm wondering, would the BC government consider to provide free RSV vaccine to people in higher risk? Thank you.
Yeah, very good question. So the RSV vaccine, there's one that's available that's been approved for use in Canada, and it's for seniors. It's for people 60 years of age and older, which doesn't seem that old. But and it's a relatively new vaccine. So whenever a new vaccine comes on the market, what we need to do is say, who's most at risk from RSV? What's the benefit that the vaccine's going to have? How many doses do you need? What's our population, and who's going to benefit most from it? So we haven't had the opportunity to do that yet. We also know that the availability of the vaccine has been relatively limited in Canada this year. So we are looking at a couple of things. One, we have a process in Canada where our National Advisory Committee on Immunization looks at new vaccines and answers some of those questions for us. They look at, who's most at risk, what population should get it, and then we take that information and the recommendations from NACI, and we have a committee here in BC who looks at the vaccines as well and says, okay, what does that mean for BC? So we're in the process of doing that. The one thing I can say is that our data show us that RSV is primarily seen in younger people, and we know that there's some vaccines coming on the horizon for children and infants, or for pregnant people that will provide protection to infants in their first few months of life. And so those are really important vaccines that we're following as well, and that should become available, but are not yet approved for use anywhere in the world, but should become available in Canada in the coming. Actually, I shouldn't say that. The one for pregnant people is available in the US, but has not yet been approved for use in Canada. So those are coming down the line as well. And what we need to do is balance, how do we get, who's going to benefit most from the vaccines that are available, and how can we make sure we have a program that provides the most benefit to people. Right now, there are some availability of RSV vaccines for older people, and they are available through pharmacies and for private pay.
Mindy, do you have a follow-up?
No, thank you.
Great, thank you. Our last question, la dernière question, goes to Wildenette Paul with Radio-Canada. Go ahead.
Bonjour, merci beaucoup. Ma question va être pour vous, Adrian Dix. Alors, j'aimerais savoir le message que vous essayez de passer aujourd'hui. Est-ce que vous pouvez résumer en quelques mots en français, s'il vous plaît, le message qu'on tente de faire passer alors que le rassemblement des fêtes commence d'ici les prochains jours?
Notre message est simple, c'est qu'il faut suivre ce qu'on a appris depuis quelques années de pandémie, c'est-à-dire que d'être vacciné, c'est un grand avantage pour vous, pour votre famille, pour toutes les personnes que vous aimez dans votre vie, et finalement, pour ce que vous ne connaissez pas aussi. Je pense que c'est essentiel dans cette période où la vaccination est si simple, d'être vacciné. Je pense que les gens en Colombie-Britannique le comprennent. On parle de temps en temps des divisions en matière de vaccination. Le fait est que 95% des gens ont été vaccinés en Colombie-Britannique et 5% ne sont pas vaccinés. Ce n'est pas 50-50. Mais pendant cette période, c'est important de suivre les conseils de la santé publique, des conseils qui nous ont aidés beaucoup depuis quelques années, et d'être vaccinés. Mais aussi de suivre d'autres d'autres habitudes qui va vous rendre plus votre santé, mieux rendre votre santé pendant cette période. Par exemple, il faut laver des mains, etc. Je pense que ça, c'est essentiel. Deuxièmement, il y a une augmentation d'hospitalisation dans la province qui est importante. Ce n'est pas une question en particulier de COVID-19, mais ça va être de plus en plus difficile pendant des semaines à venir. Les gens se rassemblent beaucoup plus pendant la période de Noël et il faut être prêt et on est prêt pour cela. Par exemple, il y a 10 000 personnes à l'hôpital à l'heure actuelle qui est beaucoup plus que l'année prochaine à cette date. Donc, il faut continuer ces efforts. Et finalement, que notre système de santé marche très bien à l'heure actuelle en termes de chirurgie et d'autres éléments de notre système. On fait vraiment des records chaque semaine presque en matière de chirurgie et je pense que cela démontre la capacité de notre système, mais aussi le fait est qu'on vit une période où il y a beaucoup de gens qui sont malades, beaucoup plus que des années précédentes en général, et cela mettre de la pression sur notre système de santé. Et pour toutes ces raisons et d'autres, c'est un bon moment, aujourd'hui, demain, après-demain, d'être vacciné. Merci beaucoup. Thank you very much. Or is there another question?
An autre question, Wildernette?
C'est ça. Oui, j'allais avec une question, a follow-up for you also, Minister Dix. En français, encore une fois, dressez-moi le portrait, s'il vous plaît, de la COVID et de l'influenza. Qu'est-ce qu'on voit en ce moment sur le terrain en Colombie-Britannique? La COVID, j'ai compris, ralentit, l'influenza s'accélère et d'autres maladies respiratoires. Donc, peut-être me dresser le portrait de ce qu'on voit en ce moment et les conseils que vous donnez à la population alors que les rassemblements vont commencer.
Il faut être conscient de COVID-19 comme surtout chaque hiver. Je pense qu'on a moins de COVID-19 maintenant qu'au mois d'octobre, qui est une bonne chose. Mais on comprend bien l'effet de cette période d'hiver qui est la période des vacances. Et il faut, je pense, être prêt à prendre les actions de ne pas aller à une soirée si on est malade. C'est simple, n'est-ce pas? Et cela vaut la peine pour tout le monde, pour ceux que vous aimez, vos amis, vos parents, vos grands-parents, vos enfants, tous ceux qui vivent avec vous dans une vie. C'est, je pense, important. Je pense qu'on a une bonne situation en Colombie-Britannique dans la mesure où on a beaucoup plus de monde vacciné. Mais de prendre l'opportunité d'être vacciné cette semaine serait une bonne chose pour tout le monde, pour votre famille, pour tout le monde. Et j'assure tout le monde qu'il y aura cette possibilité un peu partout dans la province cette semaine. Et je pense que c'est un bon moment d'être vacciné. Merci. Thank you.